All right, continuing care really goes around what we were talking about before. So what we're talking about with continuing care is what offices call recall. Okay, we don't call them recall anymore. We're trying to elevate our language a little bit, but we're calling them perio maintenance or continued maintenance or continued perio whatever. Uh, who who has a different way of, what do you call them in your offices? Anybody want to volunteer? I can't see my screen anymore.
I guess like recare or continuing care. Okay.
Yeah, recare seems to be the standard. We're still going to be seeing a lot of recall. Now, when you're in perio, it's perio maintenance or PM, but we really are trying to elevate what we're doing for the patient. It's not just a cleaning. You're here for your cleaning. We're trying. Also, this comes from the front desk. It's not a checkup that they're doing. We are not doing the checkup. We are doing medical history review. We're doing vital signs. We're doing oral cancer screening. It's more than just a checkup. So let's try and elevate our language to correspond with the education we're getting as well. So we're calling it what we're calling it. Perio maintenance is it's an insurance term also. After you do your 4 quadrants of therapy, scaling and root planing, when they come back, they're never an adult prophy after that. An adult prophy means that they have healthy periodontium, no bone loss, no apical migration of that junctional epithelium has occurred. So they're always going to be a perio maintenance after that. So our therapeutic goals, as you know, are to maintain a functional periodontium that works, all right? So the purposes and outcomes of our perio maintenance: resolve inflammation, eliminate bleeding on probing, restore tissues to normal contour and texture, create an environment for healing, arrest disease progression, provide patient comfort, encourage patient oral self-care, create an environment that deters recurrence of infection, and always motivating the patient to participate in continuing care. So there's nothing different from a regular appointment with this, but this is a perio maintenance appointment. So we are doing a full assessment at each of their appointments, especially if it's a perio maintenance appointment and the patient's had periodontal infection in the past. We know those are prime sites to be reinfected. So we are monitoring them very carefully. Now, we might not be doing a full comprehensive perio charting every 3 months when you see them, like you will be in clinic. Now, we do this in school because repetition gets you better, gets you faster, gets you more accurate. So it's the repetition of doing that we're after. In private practice, if you're seeing a patient every 3 months, you might not be doing a full charting every 3 months, but you'll be comparing. Okay, you'll still be probing, you're just not writing everything down, right? And you're making your notes accordingly. So you're from your assessment, you're developing your continuing care plan, and you're deciding really when does the patient need to be referred out if you're a general practice. I've worked perio. I was the one getting those hard cases that general practice couldn't maintain. Okay, so if you know the patient's going to need surgery or something's not healing, you need to talk with your employer about when to refer. And as I've said before, offices will vary. I know one new graduate said her office, if there's 4 millimeters or above, they just get the patient out because they just want to be a recare. Okay, they've got 40-minute appointments and they're very comfortable with that. They do check all of their patients and they refer them out. So it's an individual thing for the office, and it's what the dentist and the office is comfortable with, and what you as the hygienist are comfortable treating. Again, the frequency of appointments. You need to consider, are you able to maintain this patient with the condition that they're coming in, right? If there's too much calculus, too much stain, too much bleeding going on, then whatever frequency that is isn't working for the patient. So you're customizing it for the patient. So that frequency is going to change. And then that's part of the bargaining. Let's bring you back every 2 months for the next couple of times. Once we get this bleeding under control, we can start spacing your appointments out a little bit farther. Okay. What are the patient's medical conditions and other factors that have to go into this decision-making process? Are they able to take care of their teeth and their mouth like they should? What is inhibiting them? Is it motivation? Is it finances? Is it stress? Is it dexterity? Okay, those type of things also will determine how frequently you bring that patient back. And then the special appointment requirements. Do they need to be on pre-medication? If they do, antibiotic pre-medication, for example, you want to do as much as you can in that appointment because they are on that antibiotic. So you are trying to maximize that one dose instead of have the patient come back frequently, having to take those 4 amoxicillins each and every time they come in. Do they need morning appointments? Do they need afternoon appointments? Do they need shorter appointments? Okay, and those shorter appointment patients are going to require more frequent intervals as well. So you're just customizing everything. Methods of continuing care systems, you're going to be getting into this more on your last semester here, but there's the pre-book or pre-scheduled method, which is in favor now, where before the patient leaves your operatory, you have booked their next appointment. So you're making the appointments for them. It's on the computer, it's not a problem. You're giving them, do you like morning? Do you like afternoon? I have 10 o'clock on such and such, or Susie has 11 o'clock on such and such. Okay, you want to gently give them a way to not have them see you if they don't want to see you again. It makes it very awkward. Or if you never want to see them again, then you're always saying, Susie can see you here and Susie can see you there. But pre-booking is the method of choice versus the monthly reminder would be they'd get an email or a text message or a postcard saying it's time for you to come in, call the office for an appointment. That is, that's only done in select cases now. We are needing to document everything, especially if the patient isn't compliant with coming in. We have to document. We've attempted to call the patient. We've emailed the patient or texted the patient or called the patient or sent them postcards. That all has to be in the chart so we don't come back as looking like we've abandoned care. All right. So patients are famous for going, oh, it's been so long, nobody called me. I had to call you. And then you can pull up the chart. In the old days, it was their recall card. We had little index cards. And I could see that, well, we called you on this date, and on that date, and we left messages on your phone recorder. You know, so again, we need to be able to document that we've tried to reach you. All right. We're updating their histories with the documentation, what brings you here today, any questions that they have, and again, any findings during their examination. So we really are always educating and motivating our patients. And that, my friends, is the end of what we need to do today. So are there any questions? We are going to meet back at 11 o'clock for our whitening.